Our JEE Joint External Evaluation support countries to develop the roadmap national action plan. So followed the JEE, we have the data, we have the information, and how we can utilize that information is we followed to development for the national action plan for the health security, mostly for the next 5 years. And we work, every country work on addressing the gaps and to improve their skills for the prevention and control of infectious diseases. Moreover, this joint external evaluation assessment provide and guide the allocation of national resources, that how we have to assign our resources, on which gaps we have to address, then engage the current and prospective donors and partners to effectively target resources and technical assistance, that how different donors can play their significant role in supporting the countries for developing and addressing their gaps as showed by the joint external evaluation. So this was the overall importance of the joint external evaluation. We will talk more about it on our next session. So before that, I would request, please note down few very important points for this today events, that how we will manage. So it is requested you all that keep yourself muted during the webinar. Then we will take two audience questions from our panelists at the end of the session. We have 4 panelists from the different countries who recently completed their JEE. You can ask any question to our panelists. Even you can type your question in the box, in chat box, or direct message one of our co-hosts if you would like to ask it anonymously. Then our co-host will pass questions to the moderator to ask the panelists. Please also note that this session is being recorded. This is important as we hope this information will be useful for the others, and we will post this on the GHSA official website for the capacity building and learning purpose for other members of the GHSA and other countries. So finally, hopefully, we will learn together about the JEE. Now I will stop here with few thanks to our US colleagues, the Global Health Security Coordination Office, Republic of Korea, Thailand, Pakistan, Nigeria, and Nepal for arranging this very important event for today. So that's all from my side. So now I would hand over to Dr. Raj for further moderation of the session of the today event. Thank you very much, everyone.
Great. Good morning, good afternoon, and good evening to everyone. And thank you very much, Dr. Abbas, for a very nice introduction. So what I'll do initially is I'll start off with a quick overview of the JEE within the environment of all of the various tools. And I'm sure many of you here are already familiar with this, but it'll be nice to start off on the same page. So I was wondering if Mike, if you could maybe share the one slide. That's I promise that's one slide. So I'd like to also echo Dr. Abbas and just thank GHSA and all of the various colleagues that have worked very hard in the background for many, many years to actually transition from the initial idea that GHSA had in doing these face-to-face evaluations to the now JEE that was developed so that it would be in line with the IHR. So if we could go to the only slide, the next slide, please. Great. So I'm sorry that it's a bit busy, but what I wanted to show here was where the JEE sits within the various tools and acronyms that many people might be familiar with or have heard. So what we've had since 2010 was this formal way of reporting to the World Health Assembly, and that's the States Parties Annual Reporting Tool. And when we had the first outbreak of the pandemic in 2009, there was a request from the review committee to actually enhance the self-reporting with a face-to-face internal evaluation of countries' capacities, and also to actually look at the national systems to see how efficient the systems were. And within that context, we had developed the joint external evaluation to augment the assessment component, but also the simulation exercise and after-action reviews into one package called the IHR Monitoring and Evaluation Framework. Now, part of this means that the States Parties Annual Reporting is a very efficient but a very blunt instrument to actually report to the Assembly on how countries are doing in the implementation of the IHR. The joint external evaluation then shows countries' commitments to transparency, to good governance, to the multi-sectoral approach that everyone's been asking for, by volunteering to take on this heavy load of actually doing these assessments in their country. This includes a self-evaluation process, which may take months, and then, of course, the 1 week external evaluation. And with this data that we get from the JEE, it becomes very, very important, because this, along with national priorities, a risk and vulnerability assessment, and the results and the recommendations that come out of the JEE are then all used to develop a national action plan. And this national action plan has an operational component, which is 1 to 2 years, and a strategic component. So you see that the JEE sits very well within this assessment and planning approach, a risk-informed planning approach. The other components that we use, the CIMEX and the after-action reviews, are mainly to see how the system, we go from indicators to system and see how the system now has improved or stayed stagnant or maintained capacities or regressed in with the capacity building and investments that are being made in the system. So this is the landscape of the various tools and processes that we have. So the JEE forms a key component of this, because this is the first time that countries actually, in many instances, where they have this multi-sectoral approach, where all the ministries and all the CSOs work together, and also invite external experts to come in and talk. I'll just end with by saying that post-COVID, during COVID in 2020, in November of 2020, we had sent out a questionnaire to all national focal points to see how they were coping with and how they were responding to the initial stages of the pandemic. And we used that data. It was a questionnaire that came back to us. We used the 130 countries that responded to us, along with a meeting the following year in 2021, to actually update not only the States Parties annual reporting, but also the joint external evaluation. So we are now in version 3 of the joint external evaluation, and the national action plan and the strategy linked to that. Since then, as many of you know, the World Bank has been using the indicators that we've all developed, because many of our colleagues here, the agencies here, US CDC especially, and other agencies, have all worked together to develop these indicators and update them to the new realities that we now face. So it becomes, we did about 35 JEEs last year, which is a huge amount of JEEs, and our regional offices and our partners on the ground in these regional offices and countries have been key to working with countries to actually achieve these numbers. So I'll stop there, and I'll move on to introductions, because if there are any questions, we're happy to take them in chat. And I think the session's being recorded, as mentioned, and happy to share any of the slides that come up from this as well. So I'll take a breath, and I'll move forward to actually introducing our 3 panelists. So we have 3 panelists from Pakistan, Nigeria, and Thailand, and all 3 panelists are very well experienced in not only the preparation phase of a JEE, but they've actually worked their way through in coordinating not only in country, but also with the external experts that came to their country and the follow-up post mission. So Dr. Zishan from Pakistan as our first panelist. Then we have Dr. Okun Ramada from Nigeria, and Dr. Shuksnum from Thailand. And I'll hand over to maybe Dr. Zishan to do a quick introduction for maybe about a minute or so, and then move on from there to Nigeria and Thailand, please. The floor is yours.
Yeah, thank you very much, Dr. Rajesh. So I am Mirza Zishan Iqbal Beg. I'm working as a epidemiology and surveillance lead for the implementation of integrated disease surveillance and response system. I'm also a member of the National Technical Working Group for Joint External Evaluation and National Action Plan for Health Security. Besides that, I'm also senior faculty for Field Epidemiology and Laboratory Training Program for Pakistan. Thank you.
Thank you, Dr. Zishan. Dr. Okun Ramada, please.
Thank you, Dr. Rajesh. My name is Dr. Oyelado Ramade. I'm the head of department for surveillance and epidemiology at Nigeria Center for Disease Control. And I'm also the national focal point for IHR, as well as the GHSA focal point for Nigeria. And recently coordinated and led the process for the second joint external evaluation for Nigeria. Thank you, Anova.
Thank you, Dr. Okunaramate. Apologies. Dr. Chuxnam, please. Volume. Microphone. You're on mute.
Yes. Hello, I'm Dr. Chuxnam. I'm a veterinarian in the Division of Epidemiology, Department of Disease Control, in Public Health. I am the Thailand National Focal Point over here, and also working for the HR Coordinating Office over here too.
Great. So I'm sorry. One of the things I was hoping that everyone could also say is, in what capacity were you engaged with the JEE? If you could start off with Dr. Chuxnam, and then we can work our way backwards, please.
Yes, what we have worked for the JEE because Thailand we have done the first JEE in 2017, and we are the first country that do the second JEE in 2022. And the reason why that we have to do the second JEE, because actually we put it in the schedule every 5 years that we have to make it done. And the JEE process that we want to measure our capacity. Because after the first JEE, we faced with the COVID-19. And when we are developing the capacity building and also capacity development of the first JEE, so Thailand can respond for the COVID-19 very well. So we try to measure our capacity again after the COVID-19, what we have done and what we have still have a gap. And actually, we have a concern too, because along the COVID-19, we have a force to do mostly for the COVID-19 very much, and we have a really limited time for preparing the second JEE. But by the way, because we have a good cooperation between the stakeholders, and we have engagement with the key stakeholders, including the government agencies, NGOs, private sectors, and also the community also, because along the COVID-19, we have community engagement too, and what we have to decide to get before and after the COVID-19. But by the way, we have versus COVID-19. So what we have to concern is the gap, and also actually the one thing maybe every country have to concern about the score, because we think that the score are very important. But for Thailand, especially for me, the score is not important. But for the higher level, I mean the politics or the higher level, they concern about the score. But for me, I concern about priority action and recommendation from the expert that come to assess us. So along that time, along the JEE, we have prepared and also involved for the stakeholders. And the political commitment is the one that we have to concern and challenge us. We have a good leadership from the Deputy Prime Minister. Though he is the Minister of Public Health too, another position. So he helped us, and also our higher level in the public health sectors, and also from the government, others department, and also government agencies help us for preparing. And that is what we have planned. And I think that what we can advise for the other country that have to interest with the next JEE. The one thing is planning, because we have a planning. Yes.
Sorry, Dr. But you might be bleeding into the specific questions. So if I could quickly give
Okay.
this to Dr. Okunramate and Dr. Zishan, just to quickly tell us your role in JE and how you were engaged with the JE, and then I'll come into the specific questions if you don't mind.
Okay, thank you.
Thank you, sir.
My role of the JE, I'm the manager as I'm working for the JE National Focal Point and Coordinating Office that we have involved for the stakeholders and preparing and for the planning. As we have talked for the planning for the next JE, we have planned for the past JE and have a schedule and continue the work and also the gap for the past JE and coordinate with the other agency
Okay.
and also setting the schedule for the next JE. Thank you.
Thank you, Doug. Thank you, Doug. So if you could move on to Dr. Okunramate, please. You're on mute.
Dr. Rajesh, thank you very much. As I mentioned when I introduced myself, I led the coordination team for the second joint external evaluation for Nigeria. But I would like to state that Nigeria conducted the first JE in 2017 using the first JE tool. And I was part of the team that was part of the technical lead for the first joint external evaluation in the country. Following that, there was an introduction of the JE 2.0 in 2019, which Nigeria also used that to conduct a midterm assessment. So this was just an internal assessment within the country.
Yeah.
And I was also part of the coordinating team for that process. And coming 2023, I led the coordination team for the entire country JEE for the 2023. So that is my role and in the process. And I would like to state that Nigeria understands the crucial importance of JEE in achieving IHR as well as the global security agenda. It's one of our crucial role to ensure that we host a public health system, which is expected every 5 years. So following 2017, we're able to use the 3.0 tool to conduct the second national JEE in 2023, which I led the coordination team. Thank you.
Let's start with, so I've got 4 questions, and I thought we'll just go through the first question now, and then I'll hand over to the panelists so they can tell us about why. So the first question is, why did your country decide to do a JEE? And what was the most important component of that decision? And what do you see as the benefits in conducting a JEE now that I think all of the countries here have done 2 rounds of the JEE? So you're well experienced in not only prepping it, but also running it twice. So who would like to start?
Okay, if I can go first. I would like to share Nigeria experience in conducting the second JEE. As I mentioned, JEE is a crucial component of the IHR-MEF, which you presented, and also one of the critical components of the GHSA. It is recommended that JEE is conducted every 5 years, but between 3 to 5 years. So Nigeria conducted the JEE previously in 2017 using the JEE 1.0. Following that, we developed NAPS, which is a 5-year plan for National Action Plan for Health Security, getting the recommendations and the gaps that were identified during the first JEE. And we follow through with the NAPS implementation, intentionally use that to build health system, health security over 5 years. And following that, the NAPS expired in 2022, and we started around developing what do we need to develop the second NAPS for to further re-identify and recalibrate on the successes that we've achieved. And the discussion came around conducting the second JEE, and that was around the time the new tool was introduced with more indicators as well as changes in some technical leads based on the lessons learned from COVID-19, which actually make it more important for countries to reassess and reevaluate security situation post COVID-19 pandemic experience. So following that, the need for us to objectively demonstrate what the progress has been in our health security across all the 90 technical areas to ensure that we set a new benchmark, the development of implementation plans and the roadmap action that will guide the development of the National Action Plan for Health Security 2.0. So this was one main reason why we set out for the second to ensure that we conduct a second JEE. Most importantly, to identify the priority actions across the various technical areas post-COVID-19 that we need to further strengthen, and also use the recommendations from the second JEE to inform the development of the NAPs for National Action Plan for Health Security 2.0. And also for us, we're able to identify what are the strengths that we need to reinforce and ensure that we continue to imbibe, also to identify what are the weaknesses that we need to re-strategize within our health security system as a nation to ensure that we tackle it as a country and further continue to build a resilient health system for the country. And also, shortly, I would also touch on your benefits. You mentioned what are the benefits so far. For the JEE 2.0, using 3.0 and the second JEE, it has provided us an opportunity to further strengthen our capacity for collaboration. There is no JEE without collaboration. So we've been able to use this to build further relationship with international partners, both international organizations as well as the local partners, and to also foster a collaborative environment within the country across different sectors for addressing shared challenges using a One Health approach in a One Health space. The exercise has been able to bring together all the major stakeholders, partners, new organizations across the health security space, so that both locally and internationally. And we've been able to also build this on improving preparedness in the country. This evaluation has provided us an opportunity to increase country preparedness for emerging infectious diseases and other health based on the gaps that have been identified within this second JEE. So I would say it's an opportunity for us to look at what we have done so far in terms of the health security space and how can we recalibrate on this to further buttress and improve and strengthen the health security in Nigeria. Thank you, Anova.
Thank you, Doctor. So I think there's some very important points about not only setting a new benchmark when you went from the first JEE to do the second round of the JEE, but also in very importantly identifying the strengths, because a lot of the JEEs are not there just to identify gaps, but it's also to identify best practices and what has improved or the unique way countries actually develop capacities. And the benefits, and this is for the benefits, one of the key things that we've been actually in-house and I think across agencies is to maintain, develop and maintain that collaboration between the various sectors, between the various partners, public, private, internal, external. So thank you very much for a very nice summary. Dr. Chuksnam, if you'd like to go next, please. I could repeat the question if you'd like. It was, why did your country decide to conduct the JEE? What was most important and what were the benefits?
Yes, like I have talked previously, that what we have decided to do the second JEE because we have a roadmap. And roadmap is that the JEE, first JEE and second JEE should be in 5 years. And we have for after the first JEE, we have NAPs that we have to follow up what is the priority action that and activities that Thailand should have to have be done. And it's like the homework that we received from the past external evaluation. And on the second JE, we have to answer those homework, but what we have done. And actually, as we have our roadmap and also we have to do our homework, and we really want to compare the capacity between before and after COVID-19 pandemic outbreak, that what is important and what is the priority and what is Thailand should develop after the COVID-19 pandemic in situation. So we decide to compare this for the first one and the second one. And what we have the benefit. Actually, I have talked like previously that the score is not important as the recommendation from the expert. And what we have still have a gap. Yes, after the COVID-19, we have a gap, especially from the immunization. We cannot couldn't do the coverage of the measles vaccination at that time because we pull the capacity to vaccinate the COVID-19, and we accept that. And those we have received from the expert, and we really want to utilize the expert that recommend Thailand for the next or the what we have to be done, and have a better and better from recommendation. Thank you.
Great, thank you very much. Thank you very much. And I think it's also important to identify many countries that had done after action reviews after COVID-19 and documented what worked and what didn't work and made changes or tweaks to their existing plans. And so Dr. Zishan, nice to have you back. So please go ahead. And the question was basically how did Pakistan decide to conduct a JE? What was most important, and any benefits identified?
Okay, thank you very much. Sorry for inconvenience. I had a connectivity issue. So
No
you
problem.
know that Pakistan conducted or volunteered for the first joint external evaluation in 2016. And you must be aware that the diverse, culture and the topography of the country and some other socioeconomic challenges, we are among those countries, having double burden of disease. So mostly, predominantly in, early part in 2000, from 2000 to 2010 till 2020, we were facing the most of the cases from communicable diseases. And then there is a shift from communicable to non-communicable diseases. So at that point of time, as you know, that Pakistan is a country who is disaster prone and facing other calamities. In 2011, we were hit with catastrophic floods in 2011. Caused more than 8 people were affected, and point regard and so these were the issues.
Sorry, Doc, you're breaking up again. Okay.
Yeah, is it okay now? Okay.
Yes.
So in 2011, that constitutional amendment, 18th constitutional.
Oh, I'm sorry. I think we yeah, I think Dr. Zishan dropped off. But just to augment, I remember when Pakistan first did their JE, they were the first in the region, as Thailand was in the Sierra region also, and it was complex because it was a federal country, and they were volunteering for something that hadn't been tried before, and they had invited a whole bunch of various agencies, and at that time we had strong support from US CDC as well, who sent us experts for a I think it was a 10 or 12-day mission. So it was a very good learning experience for us to improve our joint external evaluation, as it was for Pakistan to engage with all of their various states. Thank you, Doc. Dr. Abbas. And
Yeah.
Go ahead,
Dr. Rajesh, can I speak on the behalf of Pakistan? Because I think there is a connectivity issue with the Dr. Zishan. So as Dr. Zishan mentioned that we initially first JEE conducted in 2016, and followed that JEE, we developed our National Action Plan for Health Security. And we identified a lot of gaps under 19 technical areas. And we, after 5 years, we showed progress on that, and we strengthened our capacities. So now in the recent 2023, we conducted again our joint external evaluation, second joint external evaluation, using the third edition of this new tool of the JEE. So the need of the joint external evaluation, it's very important to provide the baseline information and baseline data, that what are the gaps of the country. So that's why it's very important to assess, and in addition to there is other assessment methods as well, annual SAPR reporting. So this joint external evaluation. So this is very important to provide the baseline information on which we can identify that these are our priorities and how we can allocate our resources to overcome those challenges and to strengthen our capacity. So that was the major importance for every country to do this joint external evaluation. So that it's very beneficial for the country, and it guides the countries to develop their next activities plan for next 5 years to strengthen their capacities and so on. Thank you. Over to you, please.
Thank you very much. And so I'll just quickly move on to the next question, because I think it's very related. So while the three countries are planning for the JEE, what were your initial questions or concerns before embarking on completing the JEE? So Dr. Abbas, do you want to start, and then we can work our way backwards so everyone...
Yeah, thank you very much. So initially, we coordinated with the WHO that we are planning to conduct this joint external evaluation, and then we involved all the partners. Initially, it's a very comprehensive exercise. So initially, when we planned this activity, we in Pakistan, we have actually the devoluted health system. Our all provinces are devoluted after 18 amendments, so they are responsible for their health system at their own. So from the federal level, we provide the technical guidance to all the provinces. So we initially conducted our self-assessment. We involved all the sectors, the relevant sectors. So it was a multi-sectoral assessment. We involved all the livestock sector, then environmental sector, then other sectors. So based on that multi-sectoral assessments, and we linked and we collected the data initially based on the previous assessment and National Action Plan for Health Security, which we established in the 2016. So after collecting that information, self-assessment, we requested WHO to send the third party for evaluation. So initially we conducted the few meetings. Then that external party visited the different areas and regions. They verified all the documents. There was a few exercises and workshops at the national level and at the federal, at the provincial level as well. So in that way, we compiled all the information from the provinces level, subnational levels, and at the national level. So again, now our second joint external evaluation report is in the draft form. So we are translating the gaps and recommendations of that JEE into our National Action Plan for Health Security. So again, we are developing the plans for the subnational level, at the provincial level, and then we will club those plans cumulative for the national. So these were the few challenges which we faced during the second joint external assessment, because we need to assess the different sub-level and subnational levels, different provinces, then club that information. That was a challenge for us.
Thank you very much. Dr. Chuksnam?
Yes. what we have to concern is maybe the same as the MOSAM, and we face with many technical areas and engage with many stakeholders and partners. And those partners come from various organization and institute, for example, from the government sectors, NGO, private sectors, and community engagement too. And those is what we have to concern, because we have to use like a One Health initiative that for example, for the AMR, we have to answer with the human, animal sectors, and also environmental sectors. And the same way as the laboratories and also other technical area that have to combine with many stakeholders and partners, that we have to collaborate and communicate. The communication between those stakeholders for the evaluation. But luckily, before the JEE, Thailand have done the it's not the AMR, is the interaction review.
GHSA?
With
Yeah.
yes, no, yeah, is
UHPR, sorry.
Yes, you are GHPR, and also COVID-19 interaction review too. We have those two assessment and evaluation. That's how we have can plan and practice. But it's not the whole JEE, because the JEE complies with many technical areas that we have to be done. And also what we have to concern is that we have schedule, have to follow the past NAPS activities. What activity have to be done and what have not to be done. So you have to have check, and also checking out the new tools for the JEE, because the first JEE we use the first version of JEE, but the second JEE we use the third version that we have to verify before. Thank you.
Great, thank you. Dr. Kunramati.
Okay, thank you very much. And I would say that from the experience from Pakistan and Thailand, the initial questions that we have to address, it's quite similar in terms of across the same process of the JEE. So for us, we also communicated to HQ, WHO HQ, on the need for us to conduct the JEE, and they share the document required and the new tool, as well as the proposed timeline. And that is where we had the first challenge. So I would say that we had a proposed timeline, which was, we proposed about 3 to 4 months to start and conclude on the JEE process, while the proposed timeline from HQ was far above that. And we looked at the time that we had to be able to make that possible. So within that short period, we tried to make them understand that the funding available for that purpose would expire within a short time, which was a World Bank fund through GHSA, and the need for us to do it within that short time, which they agreed based on the capacity and if we're able to do it. So the initial challenge we had was setting up a coordinating team within that short time and ensure that we had the first initial multi-sectoral engagement. We had to do a lot of advocacy, engagement, and all that within the period of 3 to 4 months. And it was quite intensive. And for us, we were able to pull through. But the initial challenge, the initial concern that we had looking at that timeline was being able to bring all the stakeholders together across all the sectors, ensuring that we get the government political will to our side, and also all the resources required, not just financial resources now, but in terms of the technical expertise. Because it's been like 5 years after we've done the first one. There's been a lot of shift in terms of the technical team. People have retired, some people have left the service, and we have to assemble the new team and start introducing the tool to them, and coupled with the fact that the tool has changed over time. So getting the team to understand and have a better understanding and the technical skills for the use of the tool was one hurdle that we had to cross. And across that, we had to also look for how to hire a consultant that has a good experience in the conduct of the JEE to assist, because it requires a lot of faces. And to keep up with that will be a challenge. And also, we also looked at other priority programs, other health programs within different organizations at that period that could be conflicting with the short timeline that we have for the JEE. So we had to do a lot of stakeholders engagement, advocacy across different multisectorial to ensure that they prioritize JEE above the other programs that they had. And these are some of the concerns that we had completing the JEE. But aside that, we were able to quickly put the team together, and we're able to conduct the internal assessments within our own space, looking at the tool to assess ourselves to be able to define where we are in terms of the health security before inviting the external evaluators. And I would say with a lot of focus and a lot of priority on it, we were able to surmount some of these challenges and concerns. Thank you, and over.
So thank you very much. I know that, I mean, between the systems that exist in various countries, so the challenges are sometimes unique, especially with countries that have a federal system as both Pakistan and Nigeria have. In addition to that, I think you also touched on the maybe the challenges initially during the first round in coordinating with the right partners across the various ministries, but also the different levels, and also if there were external partners and CSOs. The thing that was interesting was that you also mentioned the funding issue and where the funds came from in supporting the JEE self-assessment and the work that had to be done within that. We've heard, and as all three countries have done 2 rounds of the JEE, were there any surprises other than the change in the tools, which you also mentioned? There was a difference because we are now in the 3rd version of the JEE. Were there any other challenges that surprised you the second time around? Because the first time around, I think we were all learning from each other. We were learning from the countries that piloted this for us, or maybe not piloted, they did it for real, but we were learning on how to improve the tool and improve the system and the process we followed. But also countries were trying to learn how best to engage with the various actors. So was there anything new the second time around that was a surprise challenge for any of you, if one existed? Should we start with Nigeria and then move down to Pakistan and Thailand after?
Okay, so I'll start first. In terms of the challenges, the kind of surprises, I at my when I was talking about addressing some of our concerns. We live in an environment now where there is a lot of professional migration, a lot of attrition in the system, and this posed a lot of technical expertise constraint when we got to the JEE 2.0, the second JEE. We had just few people left in the system to leverage the lessons and the experience from the first JEE on for the second JEE. So we had to start from the scratch, looking for the technical team across different MDAs, assemble the team and start the training afresh. Of course, the training required that we are trained again on the 3.0, but we even had to start the training of the JEE afresh and put them through the process of the JEE. And not forgetting the fact that I mentioned we had a time constraint. So within that short time, we had to pull together a skilled workforce to ensure that we're able to conduct that. Another challenge is documentation availability as well as the quality of data. So challenges in timely health security document and validation. Looking at the space of 3 months and the need for us to put together available supporting documents for the JEE. With the new revised JEE 3.0, a lot of documents have changed. 5 years down the line, a lot of revisions are expected in the document and the new technical areas that require totally new documents as well. So putting all these supporting documents across different sectors together within the short time ahead of the external facilitators validation exercise was one challenge that we had to also cross, one hurdle that we had to cross. But we were able to quickly call within that time frame to call for a review workshop where we review all the available documents across the different technical areas. The documents that are not available, we assigned a technical team to work with the technical areas to ensure that we put this together, be it in the hard copy or the e-copy available for the external validation, because that would really impact on the assessment at the end of the day. Another challenge that I would say is difficulty in engaging some critical key stakeholders. We all know that in the government sector, different government organizations have different mandates, and we need a real legal backing as well as the political strong will to ensure that you are able to pull in different teams together. And for this, we developed a strategy for stakeholders engagement. We worked on different advocacy tools to engage different sectors of stakeholders, partners, and also political leaders engagement as well. And with this, we're able to have effective stakeholders communication and involvement at the end of the day. So the resistance that we're expecting or anticipating or lack of cooperation wasn't really there due to stakeholders engagement that we were able to conduct. So some of those are the few challenges anticipated or unanticipated that we encountered, and we were able to surmount that. And in terms of the supportive measures, of course, I also talked about recruiting a consultant who had an experience in the JEE to offer technical support and able to train the team as much as possible. And when it comes to the benefit of the stakeholders' involvement and stakeholders' engagement, especially involving different partners, along the line, we realized that despite the fact that we had a robust approved budget, there are different pieces and different phases of this of the JEE that were not initially planned for, that came up along the line in the process of the planning. So we're able to leverage on the partners, and they were willing to provide funding to support some of the budget's shortfall of the evaluation process. So stakeholders engagement was really successful for us, and we're able to ride on that goodwill as much as possible. And of course, we're able to also get a strong political will and support at the end of the day following successful advocacy. I would mention that the current coordinating Minister of Health has stated 4-point agenda, of which health security is one of it. And we leverage on this, and this provided us the support to navigate the political space and ensure commitment of the political engagement for the evaluation process. Thank you, Anova.
Great, thank you. So it's very nice. It's good, good surprises and surprises also, because the good surprises, part of this is that the strong leadership in-house, in-country, and having that commitment from senior leadership is key to maintaining not only the support for the assessment, but post-assessment and all the components linked to that. The attrition and the change of staff because of this 5 to 7 year period between when countries do the JEE is a challenge, of course, and there are standardized trainings that we're trying to work on together with our colleagues in GHSA to try to make sure that all countries have the support they need online whenever they need it. May I move to Dr. Zishan again and see what Pakistan's experience was? And this is because Pakistan, as the other two countries, have done 2 rounds of the JEE. what are the what surprised you, good or bad, in the second round of the JEE? So if you could share that briefly with our colleagues here. Thank you.
Yes, thank you. And again, sorry for the inconvenience. So, in 2016, when we, volunteer for the first round of joint external evaluation and the overall score according to those indicator, although the revision came in 2019, but still in 2018, we got the score of, 48 for all the, 19 technical areas. And we were surprised because we were not surprised, but those people who were involved in the decision making in the country, they were surprised that after the COVID-19 pandemic, we had a very good response, and we are among few countries who have done very well and dealt with this COVID-19 pandemic more efficiently and effectively. But still, when we came to the after the evaluation, when we got the score, it was reduced to 43. So it was quite surprising for us that if we have done very good in terms of prevent, detect, and response, specifically during the COVID-19 pandemic, why our score was got down. So as then we have to advocate those people that there are some changes in the indicators of each technical areas, and they are more explicit and they are more focused that how we will measure the country capacity, that where we are standing. So this was one of the surprising fact. The second thing was that I have already mentioned that we had a devolved setup in 2011. There was a constitutional amendment, and the provinces were given the autonomy to take their own decision, specifically for in the health sector. So another thing was the scoring among the provinces, or the preparedness among the provinces, that varies. If some provinces had a very good scores, and some provinces had limited capacity, and some have the developed, and one of the province, they had a the some to some extent they had the demonstrated capacity. So there was a difference of the capacity. So again, for coming up to the national score, it was very difficult that how we will reflect our national score, because every province, they are reflecting the separate the capacity. So there was a varying response among the provinces. Again, it was a tough decision, and when it came to the subsequently it came to the development of national action plan for health security, again the challenge was that because in 2020 March we got the first case of COVID-19. So all the process that was halted regarding the implementation of national action plan for health security, because the focus was only towards that COVID-19 pandemic response activities. And then again, the vaccine was the one of the major issue, that we did not have the sufficient vaccine at the early stage. That's why we implemented this vaccine enhancements in a phase wise manner. So these are the some challenges that we faced during this pandemic, and this is the the difference between two joint external evaluation, 2016 and then 2023. We have done so far for some technical areas, we have done very good. For instance, in diagnostics, we have done a very good work, and we enhance our national capacity as well as the provincial capacity. In surveillance, we have done very good work in contact tracing and the tracking the patients. And again, in vaccination, because Dr. Mozam, he was the focal point for this vaccination in National Command and Operation Center, and we had a very good vaccine coverage as well. So there were some of the things that we faced, and still we are working on that. So any other I think I have answered your question. Thank you.
Thank you, sir. No, it was a very good answer, and it's a key point that's been brought up many times, because as the JEE tool needs to evolve and become better, and it not only aligns closer with the States Party's annual reporting with the SPAR in version 3, but it also takes in the experiences of COVID, and we spent and we worked very closely with our colleagues in CDC Atlanta and our colleagues in the regional offices and various other experts to actually update the version 3.0. So that is something that we mentioned at the beginning of the JEE for countries that are taking this. So if they've done round 1, round 2, the scores will be different, and that reflects an improvement, and there's more granularity in these indicators and the questions that we ask in version 3. So thank you very much for highlighting that. Now, Thailand, may I move to you, Dr. Chuxnung?
Thank you. What surprised us were the new tools, as we have a third version of the JE, and when we decide to do the second JE, we have the new tools, and those are very new. Other countries haven't faced before. So the new indicators came out. For example, for the community engagement for the gender, and also from the border aspect. So it's some technical area is much more difficult, more than the first version. For example, for the AMR, we found that it's much more difficult from the first version. But we have very helpful from our subcommittee, and also from the working group. For example, they are very strong. Like we have a national committee for the AMR, for the IPC, and also for the One Health approach coordinating office they are very strong. So for the second JE is successful. It's not from me. It's from our stakeholders and our working group, and the subcommittee that maintain their skill setting up. And also we received the good cooperation with the political commitments from the Deputy Prime Minister, and also the minister from the different sectors. And the leadership support is very important, that we have commitment, and also the recommendation to ensure to improve for the indicators, and also for the capacity that we have to be done. So once again, the scoring is not important, as the recommendation from the expert. And when we receive the expert recommendation, we put it into the working group and subcommittee, and they have a very strong working along the 5 years before, and also preparing for the second JE. Okay, thank you. Over to you.
Thank you. It's very interesting to get all of this feedback. If I could ask one follow-up question to this, and it's a very nice question that one of the audience has asked. When we talk about these differences in scores between the versions of the tool, there were also differences that we'd seen many times between the animal health sector and the human health sector. So could you tell us in the self-assessment component and during the JE, how you tackle that? If we could start with you, Dr. Chuxnung.
Yes, like when we're scoring in each technical area, for example, for the AMR in human is really going very well comparing with the animal sectors. So we have to work together on the AMR plan. We use the strategic plan from the AMR to engage the human sectors and also animal sectors to be done, and also we engage the environmental sector too. This is what we have done. So when the human health are very strong, other sectors should be strong as well. So we use the One Health approach from those AMR. And for the same way as the laboratory, in for example in wildlife is really weak. So we try out to encourage them to put have their own capacity on laboratory, and also from the standard that we transfer from the human health and also animal health to the wildlife. So we help each other from those JE, and we don't put other sectors behind. So when we work together with on the One Health concept, so we are very strong and walk into the same way that we should be. And this is not only in the national level, It's also in the provincial level and also in the sub-regional level too. So although it's we have to work very hard in the provincial level and sub-national level to work together in those One Health concept. That is what we have done. Thank you.
Thank you, Dr. Jackson. And as you mentioned that Thailand was focused more on the recommendations than the scores. So I think that discussion was also important. Could I ask you the same question, Dr. Zishan, about how you tackled the animal health sector and the human health sector when they had different scores?
Okay, so first I have to ask, reply your question, or Dr. Yeah. So can you hear me?
Yes. Sorry.
Okay,
So
fine. Yeah, fine. So as you know, one of our colleague, he mentioned that there was a lot of good development in terms of capacity building and and the services that especially in the health sector for laboratory. But in Pakistan, we have expanded the surveillance system. Because I am a surveillance person, so I will talk about the surveillance that in the Pakistan have a very good. In 2016, the one of the recommendation was country should have the integrated surveillance system, and we should avoid the fragmentation not only in the health sector but also in the context of One Health. So that was a missing link in 2016, and then we initiated the integrated disease surveillance and response system. And we are now at this point of time, what we have seen during this joint external evaluation, though we have the national surveillance system that talks about the priority diseases of animal sector as well, but because the animal sector, they also have a surveillance system, but that surveillance system is not well integrated with the human sector. So although they are getting the information, but there is no mechanism of exchanging this information and how this information can be used in the the perspective of One Health or in the context of One Health. So we are working on that how we gonna integrate in term of combining or linking both the system. The second thing was that we had a a long porous border, and we have the the migration of animals. So animal movement is quite obvious from one country to another country and from one province to another province. So what we have seen during this joint external evaluation, that because that in Pakistan, we are, meat lover people, and we eat a lot of meat. And even for some, religious activities, we also sacrifice, the animals. So there are so many instances that we had a lot of CCHF cases as well. But because there was not a vector surveillance system, so that was a missing link that we need to integrate. That how we gonna integrate this vector surveillance with, animal surveillance and then with the human sector as well. So there was a missing link, and that is one of the key area on which we'll be working in future. So these are the two examples, and there are a lot of example, and I can talk about those, but I think this is sufficient for your question. Thank you.
great. Thank you, Dr. Zishan, and thank you for using a practical example on how Pakistan is moving ahead with these recommendations. And Dr. Okunramate, again, please. So briefly,
Okay,
if we could just,
you.
yeah, thank you.
Yeah, so our experience is also similar, but I'll quickly add that the JEE tool, it's a One Health multi-sectoral approach. So when you're measuring across different technical areas, you're measuring for human health, measuring for animal health, measuring for environment, you're measuring different levels, not just at the national, the subnational level. And using this One Health approach, the indicators, most of the indicators recommend that the capacity be available at human health, animal health before you can move to the next stage. So that actually, it's already like a standard that once one sector is developed, you have to wait for the other sectors to be developed before you can say that you have capacity in that particular technical area and indicator that you are measuring. The mantra for JEE is as you are as strong as a country as your weakest link. So there is no way you can move up in terms of rating yourself high on the status of implementation of health security without ensuring that you carry everybody along. So for us in Nigeria, you have to remain on that particular score, either it is 1 or 2, if it's only human health that is well developed. If animal health is not well developed, you have to wait until you bring up a lot of priority actions to build the system and ensure that you are all on the same level at par before you can rate yourself higher. Because when outbreaks come, majority of our outbreaks that we deal with are zoonotic diseases. We require animal health, human health, and even environmental health experts to respond. And also we even require laboratory capacities, not only in human health, also in other sectors as well. So if those capacities are not in place, we can't say as a country that we have a robust health system. So in that instance, if there is a lot of capacity in human health, the priority for that particular technical area is to ensure that we build capacity within a time frame across other sectors and across all levels in the country. Thank you, Anuba.
Great, thank you very much. Thank you again for being so concise and summarizing it so well. So if I may just go to a quick final thoughts question. So as countries embark, there are many countries that are doing their first round. A lot of our Pacific Island countries and many other countries around the world are doing their first JE. But there are more of them that are actually doing their second round of JE, so they can not only update their national action plans post-COVID, but also see how they can bring in more technical and other support to their systems. So if I could start again, maybe we'll start with Dr. Zishan, if it's okay. What would you advise? What takeaway or advice would you give other countries in not only prepping for a joint external evaluation, but also the follow-up after the joint external evaluation? If you could just give maybe one recommendation. Over.
So that's a, you pose a very, very excellent, question and very important question, that what does this joint external evaluation, work for the country to prepare for any, public health threat or emergency. So, what we have done, so we went through this second round of joint external evaluation, and we came up with, 7 key recommendations. And I don't want to go into the details what were the 7 key recommendations, but it was, very generic recommendation that can easily be, taken by any country. So, but because these has to be, re-evaluated, that how the country has responded or implemented or taken up these recommendations seriously. So the one of the key area on which I think country should also work, it's not about only the joint external evaluation, it's about the whole process of monitoring and evaluation framework of, this IHR. So in joint external evaluation, we can do the capacity assessment. In SPAR, we can do the capacity assessment. But what about the functional assessment? So the after action reviews and, CIMEX, they are also very important, that, after the emergency, how well we have responded, and before the emergency, how well we are prepared. So to carry on message would be that after these recommendations, the country should have a multi-sectoral, multi-hazard approach, and they should sit together, that how they going to develop their national action plan that is, very much close to the core of or heart of the IHR, how these capacity can be improved. And the second, the important thing, that after the development of national action plan for health security, I think the most important thing would be the monitoring and evaluation mechanism of this national action plan, that after 5 years, that country should know that how well they have done and what mistakes or what, flaws were in the national action plan, and how they can overcome all these things. So thank you very much. Thank you.
Thank you, Dr. Dr. Chuksum, if you could briefly have your advice for countries that are planning on embarking on a JEE. Over.
Yes, what I would like to recommend is we can utilize the external expertise from the external evaluations expert to engage, like to learn knowledge and also experiences in the health security and their science and also perspectives that can provide us like an input and enhance us to do the next NAPS, the National Action Plan for Health Security. And after next 5 years, we have a monitoring and evaluation for the NAPS, what we have done and what we have not be done, and also what is a gap along the way for the next JE. That is a process on the round every 5 years that we have to recommend. Thank you. Over to you.
Thank you, sir. And now, Dr. Okunramatu, please. So briefly, if you could give advice.
Okay, thank you. Yeah, so just a quick reflection and advice. I would say that countries who are deliberating on the JEE, this 3.0, that it's a unique opportunity actually for countries to recalibrate and re-strategize towards achieving full implementation of health security. And some of the advice I'll give is that the innovations that we did, the process we did that made it a lot easier is establishing a joint central personal evaluation coordination team. We made it as much as possible a multi-sectoral, bringing all partners on board to ensure that they are all partners and they are all key stakeholders in this process. Aside the joint, the coordination team, we also have a planning team, and we now assign each member of the coordinating team to support technical area leads in ensuring that they prepare them for the JEE. They help them to draft their presentation and also call the different technical area, as well as putting together all the supporting documents required for external validation. So I would advise, once you make up your mind to do this, start early as much as possible and start the preparation process, and never to underemphasize stakeholders' engagement. Need to commence early stakeholders' engagement, particularly to non-health agencies. There are 19 technical areas in the JEE. Some are strictly not health oriented. So there is need to engage the non-health agencies for them to come up to speed to understand why this is required. And of course, most importantly, you need to ensure political will. This is a unique opportunity to ensure that a country also inform a country resource mobilization and preparedness planning. Especially now that there's an opportunity for a lot of pandemic fund gateway, which is based on the findings and gaps within different countries. There's an opportunity to leverage, conduct a JEE and leverage on this pandemic fund as early as possible. Thank you, and over. We can't hear you, Rajesh.
Sorry.
Thank
4
you.
years of doing this, I still screw up. So thank you very much. It was a very nice way to conclude. Dr. Zishan, I see you have your hand up. Would you like to add something briefly?
Yeah, very shortly. I just want to, highlight two important components for the, implementation. One thing is that whatever you will do, I think without the, political, commitment or, political will or the stewardship, it cannot be, implemented in that way you want to implement this National Action Plan for. So this is the pivotal role, because due to the political instability, economic instability, and some other, factors, so they has to be on board, the political factor. The second factor is the community engagement, and on which we are actually lacking. So these are the two most important things whenever we are going to implement or develop our National Action Plan. So we have to take serious concentration on these two things. Thank you.
Great, thank you all so much. And it's fantastic advice, and we're really glad that you were able to spend some time with us and give us your not only your experiences, but also advices at the, towards the end of this list of questions. I'm going to hand back to Dr. Muzam in the interest of time so that we can go to the closing part of this session. So thank you all very much. And Dr. Abbas, back to you.
Thank you very much, Dr. Rajesh, for your excellent moderation. So finally, now it's the time to wrap up. So I'm hoping that the information which we provided through this event to every participant and every country will be helpful for the future. So we discussed several important points. There was a very good question from the audience regarding the collaborations and multi-sectoral collaborations, you can say. Then we discussed the few changes, how the day by day this JEE tool is changing, what are our priorities, and how this in this new world of the changing of global health security agenda, we need to strengthen our capacities. So finally, the one focus of this event was to sensitize the countries. Now it is your duty and your jobs to sensitize your governments to put in this joint external evaluation assignment, because this JEE provide you the baseline data for your gaps, and on those gaps you can identify and you can develop your initiatives, you can allocate your resources. So as being the chair for the global health security agenda, our objective is to develop the multi-sector collaborations and to promote the collaborative work, because health cannot work in the silos. So we need to strengthen all of our departments, including the life sectors and the livestock department, then the environmental section, all the relevant sectors. We need to develop their capacities. Then we can say that the country has built their country level capacities. So thank you very much, everyone. Finally, I would thanks to once again, Dr. Rajesh, for your excellent moderation. I'm very thankful to Dr. Terisik from the Thailand, Dr. Okan Ramate from Nigeria, Dr. Zishan from the Pakistan. So a special thanks to our US colleague, Dr. Michael and Dr. Fatima. They are the man behind, so they conceive the ideas and they arrange all the concept notes and everything. I'm very thankful to our Global Health Security Coordination Office for the Republic of Korea, Dr. Cheshin Ju and Dr. Yonki. They provided a lot of support and technical, all the support was provided by the GHSA. So finally, I'm again thankful to all of the participants for your active participation and very, very informative discussions. So that's all from our side. So have a good day and good night as well. See you in the next session. Thank you. Thank you. Take care.
Thank you. Bye-bye. Thank you.
Thank you. Bye.
Bye bye.